Avoidable versus unavoidable. How Freud distinguished phobia from OCD. Freud explored how repression operates in both phobia and OCD. Key points. From a Freudian perspective, avoidability is a primary distinction between phobia and OCD. Freud highlighted the developmental pathways underlying each disorder. Freud demonstrated how repression shapes both the development and resolution of symptoms in phobia and OCD. This has important implications for diagnosis and treatment. It is perhaps surprising that, in clinical settings, phobia and obsessive-compulsive disorder, OCD, are often not clearly differentiated. This is in part because patients frequently present with self-diagnosed labels such as, "I have OCD," which can mislead treatment, and in part because both disorders involve intrusive thoughts. Yet since these conditions require different treatment approaches, it is essential to develop a deeper understanding of each disorder in order to diagnose more accurately and treat more effectively. This article examines how repression functions within the psychodynamic structure of each disorder, offering insight into their developmental roots in clinical treatment. Avoidable versus unavoidable, a key distinction between phobia and OCD. From a Freudian perspective, avoidability is a crucial factor in differentiating phobias from OCD. In phobia, the distressing thoughts are typically avoidable. Individuals can distance themselves from the feared object or situation, and their overall functioning remains intact when those triggers are absent. This is well illustrated in the case of little Hans, a 5-year-old boy studied by Freud in the early 1900s. Analysis of a phobia in a 5-year-old boy, 1909. Hans developed an intense fear of horses, along with other objects such as large animals and even drawers. He became anxious about going outside due to intrusive thoughts such as, "The horse will bite me," or "The horse will fall down." However, when the feared items were not present, Hans functioned normally, demonstrating that the associated fear could be managed by avoiding the triggers. In contrast, OCD presents a more complex and internally driven picture. The hallmark of OCD is the presence of intrusive, distressing thoughts that are unavoidable and persist despite efforts to suppress or avoid them. Freud's case of the rat man, Notes upon a Case of Obsessional Neurosis, 1909, exemplifies this distinction. The patient, a young adult male, was tormented by obsessive thoughts linked to, in Freud's view, unresolved infantile wishes and castration anxiety, such as the fear that, "If I wish this, something might happen to people I love." Unlike in phobia, these thoughts were persistent, self-critical,